Did you know that while Ozempic, Wegovy, and similar drugs can be a powerful tool for managing type 2 diabetes and supporting weight loss, they are not suitable for everyone. In fact, certain conditions can make their use potentially dangerous. We're joined by Dr. Julita Mitchell from the Marcus Institute, who will help us understand who should avoid Ozempic and drugs like it, and why. If you're considering these types of medications, or if you're already using them, this is a must-watch. Dr. Mitchell, welcome.
Thank you so much. Happy to be here.
So with Ozempic being the most popular one, the early entrant to the market, what are some of the big mistakes that people make when they go on these drugs or think about going on these drugs?
So one mistake is ignoring the quality of your nutrition or diet. That still matters. Even though you're losing weight, there's a risk of micronutrient deficiencies or prioritizing just the wrong foods. What we do know is that these medications decrease appetite and increase fullness. And as a result, people eat less. But the food that they do eat, we want it to be high quality, nutritious food. That doesn't always happen.
These drugs, starting with Ozempic, weren't originally engineered for weight loss, or were they?
They were originally studied and approved for diabetics. So semaglutide was originally released as Ozempic for diabetes, and then later became approved for weight loss as Wegovy.
And that's because they noticed in diabetic populations, people lost a significant amount of weight, which then helped their diabetes.
Correct. Yes, this was a secondary outcome in the studies, and they noticed significant weight loss. And so then we started asking the question, can this be used particularly for that?
So then it sounds that Ozempic was approved for treatment of diabetes, and Wegovy is a different brand of the same drug, but that has been approved for weight loss?
Yes, and at a higher dosage. Same thing for tirzepatide. So tirzepatide was approved for diabetes as Mounjaro, and then later became approved for weight loss as Zepbound.
Now, one of the things that patients often tell me is that access to these drugs can be a little bit challenging.
Yeah, that is still something that we're seeing in our clinical practice, whether it's a matter of accessibility, affordability. A lot of patients are still having trouble accessing these medications. And so we work with patients to ensure that they can start these medications if they like to. We do have some trusted compounders that we work with if that becomes an issue.
And does that lower the cost if cost is an issue?
It can significantly lower the cost.
Okay, so there's different ways working with the companies, the pharmacies, insurance companies, and even compounding pharmacies.
Yes. Some patients or some people who would like to start these medications, they turn to online services that are only geared towards these medications. And while that can increase accessibility, it could also come with some potential downfalls. And that's having a lack of frequent follow-up. We want to make sure that you're taking this medication appropriately in terms of dosage and timing and usage. We want to monitor your labs and your body composition. And that's really speaks to the importance of having medical supervision for these medications. So these drugs are not suitable for everyone. In particular, there are some contraindications. So if someone has a personal or a family history of certain thyroid cancers, if someone has issues with pancreatitis, with kidney disease, we'd want to take special consideration. Same thing with individuals or women who are breastfeeding or pregnant. There's also side effects that come into play. The most common side effects are gastrointestinal, and they're usually transient, so they come and go. Those are things like indigestion, diarrhea, constipation, nausea, and in a way, we're leveraging these side effects to get weight loss as a result. However, if these are unbearable, then we need to start thinking about lowering the dose or maybe considering other medications.
Thank you for joining us in this crucial discussion about weight loss drugs and who should avoid them. I'm Dr. Dan Monti, Until next time, be well.